Good afternoon. My name is Alfredo Ramirez, and I'm the Director of Operation Analysis Office with the Tennessee Department of Health. So my department provides services to millions of people across the state of Tennessee, and we're operating out over 100 different locations in all 95 counties in the state. We have over 3,000 employees, which includes nurses, doctors, and administrative staff. We offer both direct and indirect services, which include providing vaccinations, restaurant inspections, investigating disease outbreaks, and distribution of grants and administration of them as well. I was hired into my role as the Director of Operation Analysis Office to basically investigate all the information silos that has popped up in our division specifically. Basically, I was their shadow IT for administrative services. IT was too focused more on the programs themselves, so like HIV, to TB and things like that. So all those resources was being absorbed by IT. So some of my additional responsibilities in my capacity is the cost allocation of several millions of dollars of hours performed by the local health departments across hundreds of call centers and thousands of grants that we received as well. Within the public sector, information silos is nothing uncommon, but these silos have a negative impact on the way we do business for the public services we provide. Some of the things we're trying to reduce, or some of the things we're trying to accomplish, is eliminate data redundancy, reduce duplication of effort, as well as centralize information that's spread across several sections in our division specifically. We're wanting to improve the efficiency and accuracy in the way we report our budgets, contracts, and inventory systems, as well as have something user-friendly for our employees. So after our division evaluated all of our business processes, we set a goal to help achieve a more integrated workflow across our budget, accounts, procurement, and records management teams. The first thing we had to do was look at resources that were currently available to us within the state themselves. So we looked at PeopleSoft, which I'm not familiar if many of you are familiar with that. It's a application provided by Oracle. It is the state financial solution. We also had our local IT within our department themselves, as well as the state IT infrastructure, and SharePoint, which was something that came on a few years ago before I started. So the first thing IT usually asks you to do before you approach them with anything is say, hey, look at what you currently have. Does that work? And so we did, and none of them work, or they were really restricted about it. And so that's when we turned to Caspio, which was the best choice in our case. So when working with the public sector, we had to be mindful of some additional hurdles that the private sector may not face. So the biggest thing is procurement of Caspio itself. So we start off with just a purchase order, a 1-year purchase order to get Caspio into our department. Of course, just getting a PO, which takes 2 to 3 months, we still had to get IT endorsement and approval for that. Once we got PO established and we were able to procure Caspio, we went on to develop a multi-year contract with Caspio themselves. Because if we kept doing the 1-year PO, we have to every year continue to get IT approval each and every time. And so, which would take, again, 2 or 3 months every single time, even though investigated the first time. Once we get the multi-year contract in place, other things to consider is you have to get your legal review team will be involved in it as well. Our state in particular have our internal legal team as well as the state legal team, which both were involved with reviewing the contract with Caspio. Another thing to look at is looking at single year versus multi-year contracts. A single year, basically, again, it's almost like a 1-year PO, but it still requires annual approval versus a multi-year contract. So if a multi-year contract is available within your organization, that's the way to go. And then, of course, using the 1-year PO to get that off the ground because it can take several months just to get the contract in place and approved. Also, another big thing was invoicing. Either you do an annual invoicing or monthly invoicing. So depending on how your agency operates, one thing what you should do is talk to your accounts management team to see if they will accept the payment or will they pay an annual invoice versus a monthly invoice. So one of the biggest projects I encountered was the development of an inventory control system. So after we procure Caspio with a PO, I have already created an application for tracking invoices that we received by our department from hundreds of vendors that perform services for us or on our behalf. And I was about to be put through my pace because I was approached by upper management to develop a system for tracking the department's 20,000 K plus assets. So the original proposed solution was given to IT, or was proposed by IT, and they were developing it. It was still in development after a year and a half. Not necessarily to blame IT in particular, but as the needs of the agency kept changing, or the stakeholders kept changing, the business requirements themselves kept changing. At that point, the project itself ballooned to about $100,000, and nothing was ever really produced from that. So after a year and a half of production and still failing to meet the business requirements, I was told, hey, you got 3 months to build an inventory control system and put it in place and get it going. So with that in place, with Caspio in place, I was able to do just that. I was able to do it in 2 months, which gave me a month to basically accommodate any additional business needs from the upper management. So some of the biggest features of the application itself is the assignment confirmation workflow. So never before within our department were we able to say, hey, I gave John this laptop. John confirmed he received this laptop. You know, some people may have done it by paper, but for the most part, I give you a laptop. I hope that you'll return it at the end of your stay. And so with this in place, you know, a person gets assigned equipment, they get an automatic email, say, hey, log into the system, confirm you have this asset. And so now with offboarding processes in place, we can print this off and say, hey, do you still have this list of assets you confirmed you received? In addition to the automated emails I talked about, we have user-specific login, and then the biggest feature is a self-audit. So twice a year, we require all employees to log into the inventory control system to reconfirm they have the asset. So this ensures that it's like almost a full audit, or a full physical audit twice a year, over 20,000 assets across 95 counties, hundreds of locations. So this keeps the system accurate and up to date. It also helps to identify equipment that had gone missing so that we can file a lost and stolen report right then and there versus 2 years after the fact. So right here are just some screenshots of the inventory control system itself. We try to keep design as simple as possible, because after all, we are state employees. And so the first thing a person sees when they log in is a list of all their assets that has been assigned to them. So just some closing remarks. Since we started using Caspio, our department has been able to take on a lot more, or our division was able to take on a lot more different challenges, such as we were able to develop a contract tracking system that was previously built in an Access database and across, you know, several different spreadsheets. So building that out in Caspio, we were able to reduce the work performed by 8 employees to now just 2. Which was, you know, allowing the other 6 employees to focus more on reviewing contracts and then data entry, which in turn helps support a multitude of health programs to get their contracts in place faster. With the inventory control system, we now can account for over 97% of our assets, and as well as we built out a monthly financial reporting system, which reports back to the public health programs, directors such as those over HIV, TB, vaccination programs. They're able to see all the grant money they receive, how much they spent thus far, so they can be more on target with meeting their deadlines. With Caspio, one of the biggest projects we're hoping to take on now is a grant management application and subrecipient monitoring. So rather than just use Caspio to handle our own internal needs, we're hoping to also be able to allow this to be a public-facing tool as well. So when a person applies for a grant, they can do so through Caspio. When they receive invoices, they can do so through Caspio as well. So we're trying to bridge the gap through the way we, in administrative services, interact with the public themselves. Thank you.